Fantastic.
Oh, I need to stretch. I'm stretching. So we're going to talk about eyes today, aren't we?
Yes, let's talk about the eyes. That'll be a good topic.
Eyes and eye problems, which seem to be a universal thing with Trisomy 13 and possibly 18. Do they have eye problems? You know more about 18 than I do, I think, don't you?
I believe there are some eye issues. I think it's dependent on the child. They're not as prevalent as in 13, I believe. I know
Well, I think,
several kids that have some eye issues that are almost similar to Grace's. And then I know some trisomy 18 kids that have eye issues that they can see just fine.
I
Normal
think
eyes.
the weird thing about Trisomy 13, I think if you just take into account full Trisomy 13, not mosaic or partial, you
Right.
you get a whole range. It's mad. You get a whole range of eye problems from seemingly normal eyes to the possibility of a cyclops type. You know, in the really extreme cases, I've seen them with
Right.
like one eye, and
Yes.
it's like it's just insane, isn't it? It's such a whatever's in the 13th chromosome has a big influence on the eye formation and
Yes. And it seems like
what's
there's
going
like
on.
specific other types of either deformities or issues with other body areas that I think will be another good discussion to have at some point.
Yeah, they do seem to be like universal, don't they? That the genetic code held in the 13th chromosome it affects the same thing in all people, but to different extents. If that
Yep.
makes sense. Did I say that right?
Hey, we're two parents just going through this trisomy 13 life, and these are our experiences of what we've dealt with either
Yeah.
the doctors or advice or just the path that we've taken in order to get our children what they need.
So, what was your first realization that something was wrong with Grace's eyes? What did they say to you?
So when we first saw her, she was intubated right away at birth. And so, she was awake, but then there would be periods of not awake. So it took us actually several weeks to figure out what her eye issue really was, because she had been sedated, and then she had her heart surgery, and then she was sedated some more. So we weren't really getting a lot of activity right away, not until we saw the ophthalmologist. And what we noticed is that when she would open her eyes or try to, we would hardly see any of the eyeball, you know.
Yeah.
We could tell she was moving, and we could tell there was movement, but we would never actually ever see anything. And it wasn't until we saw the ophthalmologist there over at Children's when he had told us, he's like, your daughter has very small set eyes, and it's considered, or what it's called, microphthalmia. So she has eyes. They're just they just didn't grow as big as
So are
as
they
our.
underdeveloped or just small? Are
They
they?
they are developed, but she also had some other issues that come along with the eyes, which when I've talked to her current ophthalmologist is pretty typical sometimes of kids with trisomy 13, which is she had a cataract in one eye, and that
I
was
remember
her.
she had an operation, didn't she?
She
I
did.
remember. I
Mhm.
remember she had her eye all bandaged up. She
Right.
looked really
So
cute with her patch thing.
she was a pirate for a couple days. Yeah, so she had her right eye. We had the cataract pulled out, and then on the left eye, she has still a small cataract, but she has a detached retina.
Oh,
So
okay.
So the ophthalmologist basically told us that her right eye would be her good eye because we would be able to remove the cataract and then check to see what her vision is. What's
So
interesting,
she has vision, does she?
she does. She does have some limited vision that we know of. And
Yeah.
we can tell because she does respond to light and to shadows and to different colors and brightness. Like she gets very excited over bright colors.
Yeah. Yeah.
So when we had the cataract removed in last year, our ophthalmologist, the surgeon, was like, "This cataract is so big." She didn't realize the size, and she said the thickness of it was almost like someone having a cataract of like a 99-year-old person.
Oh, really?
Yes, that
Wow.
that these cataracts that formed, at least for Grace, were just formed such differently, as if someone had gotten older. So
That's bizarre, isn't it?
it is because her surgery was supposed to take maybe 45 minutes tops, and she
Yeah.
was under for about 2 hours because they couldn't laser the cataract out because it was so thick and considered so old. Um, that she had to go, she said what she had to do was use an old method, go in and like scoop the cataract and pull it out of the eye.
Yeah. That's bizarre. It sounds very. I don't know how does such a large cataract sort of
Yeah, and then,
grow in such a young person, like that
right,
it causes that much trouble getting it out.
which is so fascinating because that's definitely something that I need to explore a little bit more to kind of learn more about. But what's really interesting is that her left eye, which is what we thought was the bad eye because it had a detached retina, and she confirmed, she's like, there really shouldn't be anything that we do with that eye. We should leave it be. Um, it's her left eye that actually seems to be the stronger of the two eyes now that she had that cataract removed. When
Oh,
she
really?
when she opens her eyes, and she's definitely opened them more to where you can see her eye, just again not as you and I have our eyes. And she
I don't know how great mine are these days.
well, neither do I for mine. And by the way, I apologize. Do you hear the gardening going on?
Oh, it's fine. I've got a lot of distractions going on in the background with Darcy.
Hold on, it's getting really loud. Let me
It's okay.
hold on. Sorry, I apologize. I wouldn't be able to concentrate and talk to you.
It's fine. It's fine.
um, so her left eye, it actually seems a lot stronger. She opens that one more. She focuses on it more, and we are working towards getting her glasses. So yeah, pretty interesting.
I find it weird because some of the children I've seen are born basically without eyes, aren't they?
Mm-hmm.
And it's such a bizarre thing, as if Trisomy 13 wasn't bad enough as it is. It's like, there's these eye issues in that. I think like Darcy, we noticed she well, actually when she was born, she's kind of just was like this all the time.
Mm-hmm.
She went straight to hold on, there's a notification on my screen. She went straight to where'd she go first? Neonatal intensive care unit, and then to the special care baby unit. But yeah, she was very, very like she'd peak. She, but she just wanted to sleep. She didn't want to do anything. And we saw them, and they were saying, "Oh, we don't think she's got eyelashes." We were
What?
like, "Yeah, it's really bizarre." We were like, "Oh," and then after I don't know a week or so, Beck actually noticed that for some reason her eyes were really puffy, and
Mm-hmm.
where it puffed up, it caused the eyelashes to go. They were inside,
Mm-hmm.
So they were constantly on her eyeball, just in there. You couldn't see the eyelashes. Sounds really uncomfortable. Probably was, but you know, as the puffiness from birth went down, obviously she suddenly had these amazing eyelashes that everyone wants.
Right,
And
right. I don't
we,
know, something about the trisomy kids, they all have beautiful eyelashes. It's great
yeah,
for just
I
so
was
long.
I was reading, and I think that's related to cleft issues. I think it's when there's some sort of issue in the nasal area. Apparently, that can cause this you know, these long eyelashes. And but yeah, that's just one thing I was reading about.
So when did
But
you guys actually learn she had any kind of eye condition?
well, that's it. We were from birth. You know, they kind of wrote her off, and they were like, you know, it was kind of like, go home. Here's your daughter. Go home for her to die, basically, based on her diagnosis, not on any problems. Um, and because of that, her checks and that she would have usually had got cancelled. They
Mm-hmm.
cancelled all her appointments. And as time went on, obviously she just was doing okay at that. But her eyes were quite, like, she's got big eyes anyway, but they were bigger.
Mm-hmm.
And we noticed over time one started getting quite cloudy,
Mm-hmm.
to the point where we had trouble actually seeing the I can't remember what it's called, the black bit. The pupil,
Iris?
iris,
Pupil?
pupil.
1, 2?
Yeah. We aced biology, didn't we?
That's I'll say anatomy. Anatomy. I'm good at it.
But she it was then that, you know, I think she was about 6 months old or so when they started sort of getting her appointments back in place for normal things, you know, like brain scan. And well, not normal for a non-trisomy baby, but you know, brain scan and eyes and ears and all that stuff, cleft and stuff. Um, and yeah, they found out that she had glaucoma. We went to Great Ormond Street and they were looking at her eyes, and they gave us some special drops for her eyes, which are quite strong. I think they've got like beta blockers in them, so
Mm-hmm.
they were a bit hesitant at first. They were like, "Oh, you know," they told us to look out for any problems and this and that, and we just had to put one in each eye every night. And her eyes went, like, her worst, the eye that's not as good went from cloudy back to clear,
Mm-hmm.
and they sort of decreased slightly in size to her normal size that she is now.
Mm-hmm.
Um, and yeah, we have to do that all the time. But then when we went again and she had another look, she had another checkup. They said that they feel like the optic nerve was damaged,
Mm-hmm.
probably due to the glaucoma, and they wanted to test her eyesight to try and see what she does see. Now, when we went back to Great Ormond Street again to test her eyesight, they had all these, like, you know, electrode things. They wanted to track the signal basically from her eyes to her brain and see what's actually going on.
Mm-hmm.
And she had that and had it all fine. And just before we were getting the results, she'd done one of her breath hold spells, which
Mm-hmm.
we can cover breath holding in another video and, you know, talk about apneas and things.
Yes.
But we didn't actually get the results there and then. And we're still chasing them now, actually. But what he did say was that she should basically be seeing better than she's letting on. And we've kind of doubled that with the information that we know from the brain scan. I can't remember what it's called, but the bit that it's responsible for processing information is thinner in her brain
Mm.
than, say, our brains. And what we think's happening is she's seeing well. Obviously, I don't think she's seeing as perfectly, but it's also a problem with the processing of the information. because she never looks directly at anyone or anything. She'll often look, so if I held this, she'd look at it like this. So if I'm looking at you, she'd be looking at this.
Right.
So if I hold something in front of her, she'll see it and grab it, but she's not looking at it. It's a bit strange, and it's kind of something we've just had to figure out as we go along and sort of work with her. We don't know whether she's got some sort of side view or tunnel view or anything, but
yeah, that's
we're
very
still trying to
similar
figure that
to
out.
like Grace. She
I
we
might be able to
know
show
that
you.
the with light, well, she needs to have vision therapy. That's what they want to do, is they want to try to strengthen her eyes, because they believe that with, the cataracts, you see lights and darks and shadows and colors.
Yeah,
But since we removed it, what their thought is on her right eye, with that one being removed, is that it's not strong enough to focus yet. And we need to work on strengthening her eye to actually focus on an item, on a light or on a color. So then that way, both of them, because what we'll see this eye, and then it'll kind of drift a little bit here and there. It'll focus and then go. And I definitely think that the vision therapy and light therapy is going to help, because it's going to provide, straight focus for her.
So Darcy will follow light, but she'll be very slow to react. Like the light will move and then she'll move. It's sort of that sort of, it always looks like she's processing things slow, but gets there, if you know what I mean. I mean, yeah, she's, I don't know. Let me get her. Hold on. I might be able to show you what I mean by her looking past things. 1 second. I'll get a pink monkey. Is that done? Like that stayed here. There we go. Come on. Let's go and say hello to the video. What are we doing? I need to sit you round. Ready?
Hi, Darcy. What's going on?
Hello.
Good to see you.
Let me see if we can do this. So if I hold this up, you're going to try and get it.
I'm going to have to figure out a good spot so that I can, on our next call, bring Grace on.
Yeah, that'd be cool. I think I need something a bit more visual. This is not a very, doesn't stand out a lot. Oh, let me try this. Do you see she spots it straight away?
Right.
Do you want to grab it? I don't know if it comes out clearly on the camera, but she kind of looks around it and then goes for it. See what I mean?
Right.
Do you see how she kind of looks each side?
Yeah.
So we're not quite sure what's going on. It's like she's got some sort of side vision rather than straight on.
Right.
That's a depth perception, isn't it? So she can grab.
Yeah, it's like Beck's just saying. It's almost like it's her depth perception, like she's trying to figure out where it is.
Have they talked about glasses? Because I know they talked for us. Glasses is definitely going to help Grace to focus on her vision and to kind of, again, strengthen both of her eyes. Is that something that would be helpful for her?
I don't know. I don't know at the moment, but I'd like to find out, because glasses would be brilliant. But I think, yeah, we need to get back in touch with them. Obviously, the pandemic and that's put a big halt on everything.
Yeah, it's definitely slowed us down in a lot of areas. We had Grace's hearing aids. There's another topic. Um, we were going to get those, and then the pandemic happened and
Yeah.
canceled all our appointments.
No, we've got. I mean, obviously, the important thing with Darcy is, the glaucoma and keeping that under control.
Mm-hmm.
Visually, she's kind of sussed out her own world, but it'd be nice to make it easier for her if we can, like through
Right.
glasses or something. But I think for new parents out there, I think they should mention that to the doctors, things like glaucoma, because I think that's really important to look out for, because ours was missed and has probably caused damage that didn't need to be caused if it was picked up earlier,
Yeah.
Her eye went completely cloudy before anything was even established.
Right.
Which shouldn't have happened. That shouldn't have happened. They should have been on the ball.
Yeah, I feel like there's a list of specialists that, should always be seen, if you have a diagnosis of trisomy 13 when the child is born, so that you can get those interventions right away. I mean, Grace immediately had the smaller eyes. And so I guess here in the States, the ophthalmologists, there's, some that are very well known. And so the ophthalmologist in Nebraska actually recommended us to, when we came back home to Los Angeles, to talk to this particular ophthalmologist that was a surgeon, because she was the best. And
I think she's listening to you. She's really got a concentrated look on.
Do you hear me, Darcy? You're so cute. I'm gonna have to send you some more things. Yeah?
Listen.
You like hearing us talk?
The other thing we'd noticed with her, sorry, she wants to grab her arm. What are you doing? The other thing we've noticed is she gets these like little cysts on her eyelids.
Mm-hmm.
We think that's related to the eye drops. We think that's medicine related. But yeah, it's quite a strange thing, and it's really uncomfortable for her. Hold on, let me just. There you go. I'll take the background blur off. I just noticed it's blurring her face. Yeah, it's really uncomfortable for her, and they never really know why it's happening or anything. But I don't think it happened before the medicines. I think that's another thing with trisomy children that people need to be aware of, really, is that they're little tiny children and they're on some really serious medications. And some of those medicines cause their own problems.
Yep.
And
true.
I mean, I've seen so many where one, it causes another problem, and then they need medicines for that problem, and that's another video we could do.
I would say that's another topic. Yeah, Grace has she uses erythromycin as a cream for her eyes. So after her surgery, we noticed she was having more discharge right here, and her eyes we'd have to clean them often. So we started using a topical cream, which is really helpful for her. Her left eye is now free of any type of discharge. The right eye is still, it's taking a longer amount of time, but it's helping. And we put it on twice a day. And what it does is allows all the discharge to come out. So we easily wipe it away. And then she's able to have her eyes open more. Otherwise they would stay shut. That has been really helpful for us.
I think, does Grace get things like conjunctivitis a lot? Because Darcy's had that quite a few times as well. And Right, I'm gonna give you to Mum. Hold on 1 second. There you go, my gorgeous. Right, I'm back. I think they seem to have. I know with glaucoma anyway, but I think they generally seem to have some sort of drainage issues sometimes. And no, I'm even when I sit down, I'm playing with her toys. You kind of get that constant mindset on, don't you? Yep. Just a constant parent all the time. But yeah, I don't know. I'm trying to think what other things I've noticed with other children and their eye problems. I've noticed there's a lot of visual impairment and a lot of blindness as well.
Yeah.
Obviously, if we leave out the extreme cases where they've either got one eye or no eyes or something, I'm just thinking about the children that have been born with two eyes and maybe small eyes like Grace. It seems to be very common, doesn't it? And
it does. Again, I think it goes back to there's several, possible deformities that each child can have. It's almost like which one did you get from the lottery? It's like, okay, here's your pick. Here's the pool, and you're gonna get probably one of these. Or
I've noticed. I think the more severe cases of trisomy 13 where there's real issues with just living really is the heart problems and the brain problems. It seems to be this area where it controls things like breathing and like I said, we'll get into a video about apneas and stuff, but it's like you say, you get a set sort of amount of problems, but I think most of the problems, I'm not saying are fine or long-term livable, I don't know, but I think most of them aren't as relevant in immediate danger as the heart and brain problems that are apparent in some of the children.
Right.
And
lungs. I would say lungs, because that I've seen that
there's been underdeveloped lungs, isn't there?
Not necessarily underdeveloped lungs, but I would say probably the Malaysia of either like upper or the lower, from the trachea to the bronchi.
I think pneumonias as well. That's common, isn't it? Due to throat issues. There's a lot in the midline, isn't there? A lot like this area.
And I think that's because the heart issues that happen, you'll get more common, like the ASDs and the VSDs. And I think with those, you can go a little bit longer without needing the surgery. But I think sometimes, like you said, either it could be a brain issue or it could be airway, which would be more of an immediate type of fix.
That's what I mean. Like a lot of the lung issues seem to stem from heart issues, I've noticed, and they seem to go hand in hand, don't they? You get I think, I don't know. From what I've read, though, you've obviously got a lot of these, like this area, and some of the babies seem to have cleft palate, some have cleft lip and cleft palate, and no eyes or big eyes, or it's this whole. There's just a whole range in this little area. There's so much going on that needs so much attention and medical professionals. It's just crazy, because I think that's what starts, because then you've got like kidneys, UTIs and things. They seem to be very common as well. And you've got it. I don't know. It's just like it just whenever I think of it and the complexity of these children, it just blows my mind how much stuff is being dealt with, and how much, with my other children, I took for granted, just everything was fine, really, and you don't think about these things, you know. It's like, oh, we've got a hearing test or eye test or something. It's just normal stuff. But these trisomy babies really wake you up to how much is going on.
Well, and I think too, like I always talk about Grace and all her specialists, because I'm like, well, I think we're up to 10 digits. I can count them on both hands still. I haven't gone where I needed to go over. I was like, but I don't think I can add anymore. I don't know if there's any more specialists out there. We haven't covered a certain part of the body. And you become your knowledge base just grows and grows tremendously with these kids. And you have a different experience because Grace is my first kid. So I don't know anything else other than this.
Well, Darcy's got 6 siblings. So, it's the opposite end of the scale.
Right. And I just, there's definitely questions that I have because I'm like, well, I don't know anything other than this medical world. And,
I find that really sad, though. I've seen it a few times when people have had first child and they've had the diagnosis of trisomy 13. It must be absolutely heartbreaking, if you're starting a family. And I've seen some really young parents as well who've had the same, and it's just I don't know, it just seems so cruel. It's so like, wow, really? And it's just a lottery, isn't it? It's some random. In fact, you'd have more. I think the percentages, you'd have more chance of winning the lottery, probably.
Probably. But I think what's good is I recently watched, and I will pin these onto the Facebook group, the Trisomy 13 Facebook group. I'll pull them from Soft. But they had this week the professional speakers, and they had a couple different topics. One in regards to the palliative care doctor that we worked with in Nebraska did one about quality of life, and the other topic that I watched was on cardiac and airway issues. And you can definitely tell that there's a paradigm shift in regards to the treatment of these children, and that it's definitely becoming a more open topic as they can get providers to come together to discuss these children and to change some of the language that's used out there. So I'm hoping that with these videos too that we're doing is that people will get a little bit of a glimpse of, what that real life is.
I mean, we've got one thing that the doctors haven't, and that's we're day in, day out, hands-on with trisomy 13, and the community. Doctors obviously have a lot going on and have a lot of patience and things, and I think not a lot of trisomy 13 babies make it past SCBU, NICU, and they don't get to see a lot of these specialists, and I think that's where the specialists have trouble understanding them, or there's a negative view about things or their life, because a lot of what they do is read, or they don't have that hands-on experience day in, day out. The only person, I mean, Darcy's seen many people. I mean, she's got a list of specialists that deal with her. From she's had Adam Brooks. She's at Adam Brooks from some stuff. She's at Great Ormond Street Hospital. She's got Lister Hospital, Huey 2. She's got Harefield Hospital that's been to. There's Harrow Hospital. I'm not sure what it's called. But out of all of the specialists she sees, the one in Harrow in London is there's a geneticist there, and he, pardon? Northwick Park Hospital. He's the only professional we've seen that's dealt with trisomy 13, and he'd dealt with it twice, and one of the children was 5 years old, I think. And you know, the sort of army of specialists these children get, for like from our point of view, for just one doctor to have dealt with it, it's like, you know, this is why we need to do videos and get information out and give hands-on experience to whoever we can. And yeah, talks and that are really important, I think. And I think as well is it'd be good to get other parents as well to come and speak and totally share some different experiences.
Absolutely.
So maybe we could get some sort of Zoom type calls going at some point, and you know, have I don't know, does this do a multiple thing, or is it just two people?
Oh, it does multiples. Yeah.
It does multiple.
Yeah. If
We
not,
can have like special guests from the Trisomy group or something.
we will. I already got a list. I already have people that would be willing to share some of their stories, because there's lots of topics. So
yeah, it'd be brilliant.
Mhm.
Because I'm always very mindful of that. Like, I've got a wealth of sort of knowledge that I can share that I've learned already, but I'm also learning, and also my experiences and the information that I can give might not be helpful to someone else's situation.
Correct.
And it's like I mentioned to you before about conversations within the Trisomy 13 group. A lot of people are very quick to, I mean it in the best way possible. Like, they're being helpful and share their information, but it's not always universal. Like, what might have worked for me and Darcy might not work for someone else. Which I think we were going to cover in another video, weren't we, to do with certain issues that they face, which we've picked up on are quite different responses needed.
Exactly. So
yeah,
lots of information to share. That's what I'm excited for, is
loads of information.
Tons.
But I just want people out there who watch these and are not knowing what to do, or looking for information, or being worried about everything like we do. We get that diagnosis, we drive ourselves mad on the search for information. Just try and see some different views. Don't always go with the first bit of information you find, because these children are very complex and very different. And you need to make sure that whatever you're reacting to, as in giving them hands-on treatment, make sure it's right for your child and what is happening, because these are complex children and they have complex needs, and you need to just make sure you're not maybe making it worse in some way.
And it's always good, you know, I always recommend is, you know, ask more questions. And what we were doing too in the NICU is if someone had brought me 3 pieces of information, I would bring up those 3 pieces of information to that doctor, or, you know, to that nurse that I was working, who was on her service for that day, and ask questions about, well, you know, would it be this because of certain signs that you see, or are there symptoms that lead to this? And so that well-rounded knowledge that you can get by asking those additional questions only helps to then, I think, for the parent to then make that individual decision on what that child needs. Because, you know, like you said, if you just go with the first thing, or the first item, you know, that could be wrong or could be harmful. And, you know, if you say, hey, I've been told, you know, these 3 things have come up the most, you know, let's explore those. I think that is very helpful.
It's like a topic in the group, which was about, that I mentioned to you before, about breath holding. And there's some very useful comments there on the way people have dealt with their child's breath hold spells. But a lot of them were in relation to giving oxygen or bagging, which can be different to children with tracheotomies or children without tracheotomies, or different scenarios. And also you've got they need to be mindful that it could be a seizure
Mm-hmm.
or something else going on. And it could just be neurological with apneas and things. And it's very hard to distinguish what's actually going on. And like with us, some people said that their breath hold spells were helped by oxygen, whereas with us, it would prolong a breath hold spell if we gave her any sort of help.
Mm-hmm.
And obviously we needed to always make sure that suction was nearby. And it's things like that information where people really need to, people that are watching these videos and looking for information really need to just be mindful and careful and make sure they're given the appropriate stuff. And yeah, I mean, there's a lot I want to talk about with that breath holds and that, but I'll save that for another video because that's a very big topic.
Well, I think we went over exactly what we wanted to, which was the eyes, and definitely I would say, you know, if you have a child, they're born, you know, diagnosed with trisomy 13, is definitely get that ophthalmologist, you know, on board to check out their eyes, because then you can find a good plan. And I know it's not usually the most immediate need. I think I heard that when we were in the NICU too, is, you know, we'll get to the eyes. But definitely
it's important for them. And it really changes their quality of life, I think.
Mm-hmm.
Because they get a lot of comfort out of, from what I've seen with my own and other people's children, is that they get a lot of comfort out of light and a visual stimulation.
Very helpful. Very helpful with development.
Yeah, Darcy has little fairy lights on her bed, and you know, they're great comfort to her. At night time, as she wakes up and it's dark, she gets very sort of uncomfortable, but if she sees her lights, she's fine and she's relaxed and chilled, and it does give them a great comfort. It's you know, their little windows to the world.
Exactly.
But yeah, I think we've covered eyes quite well, and from our experiences anyway.
Yep.
And yeah, I think we should just look forward to the next video.
Looking forward to the next call.
I'd like to know if anyone's watching, if they have anything that they'd like us to talk about. I'd like to hear it in the comments. Yeah, because obviously we'd like to make sure that we're giving as much information as we can to the people who need it. But we're not medical professionals. We're only talking from our experiences, guys. So
yeah, two parents important. Navigating this trisomy 13 world.
Yeah, it's a very lonely world though. So you start making up it's other parents where I think we've all got our information from, isn't it? Or reading many case studies which are normally outdated. And yeah, we'll get there with sharing the information. It's just so much. I mean, in two short years that Darcy's been here, it feels like about 90 years of medical information. It's insane.
My vocabulary has increased 100-fold just with this alone. People ask,
noticing. Oh,
are you a nurse? I'm like, no, I'm not a nurse. I'm just a parent.
We feel like medical professionals, don't we? I remember when I first noticed it, Darcy she wasn't even 1 year old yet. I remember sitting at the hospital once and we were talking to a pediatrician, and they had Darcy's files on the window, and there was like 4 other babies' files on the windowsill, and there was these 4 folders sort of piled like this, and Darcy's was one folder like this, double the size of them. And that's when I realized, wow, you know, this is a lot a lot of medical need.
It is.
And Darcy, I think as far as things go, Darcy's nowhere near as complex as some of the children I see, and I can't imagine what some people go through. Some of them have real strict regimes with medicines and stuff like that, and
Right.
we're here thinking about eye drops, and
Can definitely talk about Grace's medicine
Right.
regimen. That's for sure. That's
we should. But I think we'll end this one here if that's all right with you.
Absolutely.
And anyone watching can go and follow Grace's story on Instagram. Mine and Darcy's story on Instagram. And I'm also going to include the links in all our videos to Soft UK, Soft US, and the Trisomy 13 Facebook group, because these are all important resources for parents out there that you should definitely look at.
Thanks, guys. Till next time.
Yeah, till next time. Let me stop this video if I can.